Buenos días con todos.
Good morning, everyone. My name is Rosa Sandoval. I am the interim chief to the fourth webinar of the series NCDs, risk factors, and mental health during the time of COVID-19. In this fourth session, we are going to focus specifically on addressing prevention and control of risk factors of non-communicable diseases to hold on to gains and to foster progress. I would like to start by saying that this session is being held in English and Spanish. We do have simultaneous interpretation available. You can access it by clicking on the interpretation icon at the bottom of your screen. We also have sign language, as you can see up on the screen. I would also like to tell you that this session is being recorded for us to be able to share it with you later. Now, for Q&A, we do have also an icon at the foot of your screen, Q&A, that you can click on to pose questions to the speakers, the panelists, and also in the chat window, we will be sharing information with you. You can't ask questions live, but we would encourage you to ask your questions throughout the session in the Q&A, and we will try to address them throughout the session. Now, I'd like to invite Dr. Anselm Helnes, the Director of the Department of NCDs Mental Health at PAHO, who is going to be our moderator. You have the floor, Anselm.
Good morning, Rosa. Thank you so much. Good morning, distinguished minister, distinguished presenters, ladies and gentlemen, colleagues. It is indeed a privilege and pleasure to be here this morning. Now, we are all feeling the tremendous impact that this pandemic has had on us for over a year now, and we are conscious of the fact that people living with non-communicable diseases are at higher risk of severe COVID-19, hospitalizations, and death as a result. And they need to be a prioritized population group for services and support. So as we continue to respond to this health emergency, it is of critical importance that effective policies are implemented promoting healthier environments and addressing NCD prevention, as these diseases continue to be the leading cause of death in the Americas, even before the pandemic. In this webinar, we aim to focus on the importance of addressing the prevention and control of risk factors for NCDs, strengthening multi-sectoral collaboration towards the promotion and implementation of sustainable public policies to tackle NCD risk factors, and to protect public health interests from industry interference. We'll also hear about country experiences from Suriname and Mexico in strengthening prevention and control of NCD risk factors during the time of COVID. To begin this discussion, I'll give the floor to Dr. Jarvis Barbosa. And Dr. Barbosa, as you all know, is the Assistant Director of PAHO, and he's been leading the organization's response for priority health programs in the Americas during this pandemic. And he's been an integral member of the PAHO emergency response effort. And as part of this, he's part of the team that provides weekly media briefings. As Dr. Barbosa has not been able to be with us today, we'll hear a video recording of his remarks. So I'm going to hand over now for the video recording.
Good morning and welcome to this session addressing prevention and control of risk factors of non-communicable diseases within the context of the pandemic of COVID-19, protecting gains and fostering progress. This is the fourth web seminar of the series addressing
Durante el periodo de COVID-19,
diseases during the COVID-19 pandemic, organized by the Non-Communicable Disease Department and that of Mental Health of the Pan American Health Organization. For today's session, we have as an objective to address progress and challenges in the implementation of effective policies to prevent and control risk factors of non-communicable diseases, to promote and implement said policies has a multi-sectoral and interdisciplinary approach, ensuring that it is coherent and sustainable. We will share experiences of productive collaboration, which has led to the adoption of effective policies that are evidence-based in health, economy, and law, to offer information about the interference carried out by industry in the production of non-healthy products in our region and the role of civil society. Colleagues, the COVID-19 pandemic has posed challenges for prevention and control of risk factors of non-communicable diseases, given lockdown and the significant way that people's lives have changed. This has led to greater physical inactivity and the consumption of non-healthy food items. Unfortunately, our region has a vast experience, or fortunately rather, we do have vast experience in rolling out good policies in this area. We see this in the fact that in mid-pandemic, the South American countries have reached an important milestone, which is to institute a national policy creating tobacco smoke-free environments in the workplace and closed workplaces by prohibiting smoking in said places. Currently, the vast majority of countries of the region have implemented this measure. And today we will have with us Suriname, which is one of the pioneer countries in the Caribbean on this topic. Another clear example of this is that in 2020, Mexico, that will also be with us here today, joined 3 other countries of the region, Chile, Peru, and Uruguay, in implementing front warning labels to discourage the consumption of processed food products. This has all been possible thanks to the concerted effort carried out, working closely with authorities of other government authorities, such as the economy and trade, of the legislature, and also state, national, international bodies, all of which have played a very important role to come up with evidence-based approaches and based on best practices. Now, it's important for us to generate evidence at the national and international level to fill gaps that have existed so that we can take on head-on these topics in different environments, such as the Pan American Health Organization. We want to create local capacity for the effective monitoring of attempts of undue interference. So that's why I'm very pleased to have with us here today colleagues from many places of PAHO who have been working with us in collaboration on this very important topic. So I welcome you to this seminar, and I welcome all of the prestigious panelists who are here with us today. I would also like to invite you to take part in each one of the sessions of this series, in which you can find on the Non-Communicable Disease and Mental Health Department's webpage. Thank you very much.
Thank you so much, Dr. Barbosa. And I'd like to send my appreciation to him for taking this time to record a video for today and to provide insightful perspectives on the successes and challenges we face in this region. I would like to remind everyone that this webinar is being transmitted in simultaneous interpretation in English and Spanish. And you can find the interpretation icon at the bottom of your screen to the right side with a little globe that says interpreters. And you can click on your language of choice, either English or Spanish. Before we move on to our distinguished panelists today, allow me to compliment Dr. Barbosa's words with a quick panorama on the status and progress on addressing risk factors for NCDs in the region of the Americas. So I'll ask colleagues to put up the PowerPoint for me, please. And if you can put it in presentation mode, thank you so very much. Let's go to the next slide. Cambio, por favor. Good. Now, we have learned in the context of the pandemic. Let's go this one slide before, please. The previous slide. Thank you. We have learned in the context of the COVID pandemic of a worrying increase in NCD risk factors due to lockdowns and disruption in provision of healthcare services. Additionally, there's been a general increase in the consumption of unhealthy products such as smoking tobacco, alcohol use, and consumption of ultra-processed foods and drinks, as well as physical inactivity. It has also been impossible to evaluate the impact of these changes, since, for example, the school surveillance activities are not currently possible due to closures and suspension of usual activities. And this also applies to surveillance and population-based surveys. On the other hand, it is a matter of record that extensive efforts have been made by industries engaged in the manufacture, sales, and distribution of unhealthy commodities, and they use this to be viewed as contributing to the pandemic response in order to enhance their reputations and build political influence to then leverage their positions to try to weaken new or existing regulations. This interactive scorecard highlights progress achieved in the implementation of national commitments of the 2011 UN Political Declaration and the 2014 UN Outcome Document on NCDs, and showcases regional results from the NCD Progress Monitor across all countries of the Americas. The scorecard indicates that despite industry efforts, there has not been any setback or weakening of tobacco control measures. Most of the progress has been achieved in the implementation of smoke-free environments, as Dr. Barbosa said, through laws that ban smoking in enclosed public spaces, with 23 countries implementing such policies. Similarly, 22 countries in the Americas have passed regulations to implement health warnings on cigarette packages. There's also been significant progress on the promotion of healthy diets achieved through the implementation of warning labels on processed and ultra-processed food products in 4 countries, and these, as we heard before, Chile, Peru, Mexico, and Uruguay. Let's go on to the next slide. Cambio, gracias. It is worth mentioning that in spite of the COVID-19 pandemic, there have actually been significant milestones, such as the entire region of South America becoming smoke-free, with the approval of a law in Bolivia in February of 2020 and a decree in Paraguay in December of the same year. Regarding healthy diets, the most significant area of progress in our region has been the implementation of the front of package warning labels on processed and ultra-processed food products. This policy had already been implemented in 4 countries, which I noted before, and also passed by the Congress in Colombia on June the 20th. Argentina is also expecting this legislative discussion to take place in the Congress after the passage of the draft bill in the Senate took place in October of last year. It is important to note that PAHO provides ongoing support to countries to implement policies to reduce the burden of diet-related non-communicable diseases. Reduction of dietary salt intake at the population level is cost-effective and has been shown to reduce premature mortality from heart disease and strokes. PAHO recently launched a tool, Cardiovascular Disease Prevention through Dietary Salt Reduction, which is intended to monitor progress on the so-called best buys, which are interventions that include the reduction of salt intake through the reformulation of food products and setting target levels for the amount of salt in food and meals through the establishment of a supportive environment in public institutions to make lower salt options available, through behavior change communication and mass media campaigns, and fourthly, through the implementation of front of package labeling. This tool features 16 countries that have implemented at least one of the 4 WHO best buys. PAHO will also soon launch updated targets for the reduction of sodium content in processed and ultra-processed food to assist countries to achieve the 2025 global target of reducing the mean population intake of salt and sodium by 25%. PAHO recommends the promotion and implementation of legislation and regulation to accelerate progress towards the reduction of diet-related non-communicable diseases. Next slide, please. The policy areas that have not progressed as well are the implementation of health taxes and marketing bans and restrictions on tobacco, alcohol, and ultra-processed food products and beverages. Next slide, please. Marketing bans and restrictions of unhealthy products are critical. And we know, for example, how marketing of ultra-processed food targets the developmental vulnerabilities of children and adolescents. This is also particularly important in the context of the obesity pandemic, an urgent public health problem which will not be resolved without a dramatic decrease in the consumption of ultra-processed foods at the population level. The WHO Framework Convention on Tobacco Control, Article 13, mandates the establishment of a comprehensive ban on tobacco advertising, promotion, and sponsorship. And WHO periodically monitors progress in this indicator in the Americas in the context of monitoring the Empower package, as well as progress on implementing the strategy and plan of action to strengthen tobacco control in the region of the Americas 2018 to 2022. It is worth mentioning the example of Colombia. In 2010, the Constitutional Court of Colombia resolved a challenge against various articles 14, 15, 16, and 17 of the law 1335 of 2009, and this states provisions by means of which damage to the health of minors, the population of non-smoker, and public policies are prevented, and policies on prevention of tobacco consumption and tobacco cessation is stipulated. And basically, this challenge asserted that the ban on tobacco advertising, promotion, and sponsorship contained in the law violated the following guarantees provided by the Colombian Constitution, which were commercial speech and freedom of trade, as well as free enterprise. The court rejected this challenge, and they stated that although commercial speech should be understood as an aspect of commercial freedoms, this does not mean that it holds the same level of protection as freedom of speech or expression. Secondly, restrictions on advertising, promotion, and sponsorship do not substantially violate the commercial speech. And thirdly, even when a legal product is regulated, the state has the authority to discourage its consumption for public health reasons. And these really must be first and foremost. Let's go on to the next slide. Another challenge we are facing in the Americas is that while representing the most cost-effective policy to reduce the consumption of unhealthy commodities such as tobacco, alcohol, and sugar-sweetened beverages, the use of health taxes is severely underutilized. Only 4 countries apply taxes on tobacco products at the minimum recommended threshold set by WHO, which is 75% of total taxes being included in the final retail price. There is therefore significant room for higher taxes on tobacco. Additionally, many of these taxes are losing their real value and impact over time as a result of inflation, and they should therefore be adjusted upwards. Regarding sugar-sweetened beverages, while the number of countries applying such taxes is relatively high, with 21 member states applying national excise taxes on sugar-sweetened beverages, and 7 jurisdictions in the United States of America doing this also, there's great diversity in the design of existing excise taxes on sugar-sweetened beverages. For example, some of these taxes have not been updated for over a decade, and many are not optimized to achieve health goals. In general, the level of taxation is low. Most of these taxes could be further leveraged to improve their impact on sugar-sweetened beverage consumption in order to benefit health. This represents an opportunity to propose amendments to existing excise taxes and also to advocate for the deductions for such taxes in countries that do not currently have them. Let's go to the next slide, please. Cambio, por favor. Thank you. In conclusion, the COVID-19 pandemic has led to an increase in exposure to NCD risk factors such as smoking, tobacco, drinking alcohol, unhealthy diets, and insufficient physical activity. And this is particularly challenging for those living in vulnerable situations. Most of the progress in policies to address NCD risk factors has been achieved in tobacco control, more specifically in the promotion of 100% smoke-free environments and health warnings on tobacco packages. In the promotion of healthy diets, there's been progress in the implementation of warning labels on ultra-processed food products. It is critical to preserve these public health gains, by improving policies and fiscal measures for NCD risk factors. This means we need to scale up Best Buy measures, which include bans and restrictions on advertising, promotion and sponsorship of unhealthy products, taxes on tobacco, alcohol, ultra-processed food products and beverages. Health taxes represent a win-win-win policy in this regard for governments, in that they improve health outcomes by reducing the consumption of health-harming products. They increase the financial viability of health systems by reducing associated healthcare costs, and they increase tax revenue. In the context of the COVID-19 pandemic, health taxes may play important roles through reducing consumption of harmful products, thereby protecting the public health. And also, as I said before, they may also assist economies in the post-pandemic recovery phase. It will be critical for member states to work intersectorally and also to strengthen multi-sectoral collaborative work towards the promotion and implementation of sustainable public policies protecting public health interests from industry interference. We have seen an increased interest in health taxes, and we must use this highly effective tool to promote the public health. Thank you. So at this stage now, I will actually I hope that this panorama sets the stage for the two country experiences we'll hear about today. We have with us today Honorable Dr. Mar Ramadin, the Minister of Health of Suriname, and he'll be followed by Dr. Rui Lopez Vidora, Director of the National Center on Preventive Programs and Diseases Control for the Mexico Health Secretary. We'll first hear from the Honorable Dr. Mar Ramadin. Dr. Ramadin is a graduate of the Anton de Com University in Suriname. As part of his career, he has worked at a regional health services as a private healthcare physician. Until his appointment as Minister of Health in July 2020, he was the director and practitioner at CuraMed Medical Center, where he worked full-time as a general physician. He will share the experiences of Suriname, which has been a pioneer country in promoting regulatory measures to restrict access to unhealthy products, as it is the case in the approval of the first comprehensive tobacco control law in the Caribbean, and is currently supporting the implementation of warning labels on ultra-processed food products. So I give the word to Dr. Mar Ramadin. Thank you, Honorable Minister.
Thank you, Dr. Ellis, and good morning, everyone. Thank you for the opportunity to present Suriname's experience in strengthening prevention and control of NCD risk factors during the time of COVID-19. In Suriname, unfortunately, more than 60% of all deaths can be attributed to non-communicable diseases, especially cardiovascular diseases, cancer, and diabetes. Cardiovascular diseases are the leading causes of deaths in Suriname, followed by cancer. As known, people with NCDs are more susceptible to get COVID-19. They are more likely to develop severe disease and are unfortunately more likely to die from COVID-19. When we look at the comorbidities of COVID-19 fatalities in May 2021 in Suriname, 41.1% had hypertension, 35.3% was diabetic, 8.7% had renal diseases, and 7.1% had obesity. Since the presence of COVID-19 in Suriname, the NCD Department of the Ministry of Health conducted various interventions to strengthen the prevention and control of NCDs and the risk factors during this time. With support of the PAHO, already developed posters and folders on NCDs, the main risk factors, mental health, and COVID-19 have translated in Dutch to inform the Suriname society, such as Information Note COVID-19 and non-communicable diseases and mental health, 10 ways you can help the elderly and people with NCDs who live with you, NCDs and COVID-19, strengthening of your immune system, tobacco use and COVID-19, what you need to know, alcohol and COVID-19, what you need to know, coping with stress during the COVID-19 outbreak, program helping children cope with stress during the COVID-19 outbreak, the booklet, My Hero is You, information about COVID-19, and the self-care guidelines brochure for healthcare workers, stress management for health professionals. Since hypertension is mostly linked to high consumption of salt, two TV productions, Sakayu Sotu, Usakayu Notu, which means reduce your salt intake to reduce your morbidity, were developed in the context of the Salt Awareness Week 8 till 14 March 2021 to inform the society on the relevance of reducing salt consumption and how to prepare local food with less salt. In the context of the World Hypertension Day on 17 May, an infomercial has been developed on the risk factors, the effects, the prevention and control of hypertension, and the link with COVID-19. In the context of the World Kidney Day, an infomercial had been developed on the risk factors and the effects of renal disease, the link with COVID-19, and the experience of a kidney dialysis patient. Since tobacco use is an important risk factor, the Stoppen met Roken, which means the Quit to Smoke program, was launched and implemented in different districts such as Nikeri, Saramacca, and Comoé. In this context, various TV programs on the effects of smoking and the need to quit smoking were broadcasted. To promote healthy food during this pandemic, a custom format of a leaflet, Gezond Eten, which means healthy eating, has been developed to share the information on social media and the web pages of the Ministry of Health and our Bureau of Public Health, BOG. In addition, a video in Dutch and the Surinamese native language was developed to inform people about the importance of consuming healthy food and how they can do it the best way. This video has also been shared by WhatsApp and broadcasted on various TV channels. Some communication material has been developed to encourage the community to keep moving, especially in this period when mostly everyone is at home due to our lockdowns. To keep people physically active and promote healthy weight in Suriname, 40 episodes in total of an already developed television exercise program, Sranang Lusaski, which means Suriname Move the Body, are broadcasting by various TV channels and through the Facebook pages of our ministry. Even the Seki Siksi, which means Moving at 6 o'clock initiative, relaunched on 6th of June, where encouragement messages are broadcasted by radio and TV, and short workout videos are broadcasted through TV. Regarding mental health, a psychological helpline has been set up in the context of the COVID-19 situation for people in quarantine. Training basic psychosocial skills for COVID-19 responders has been translated in Dutch and launched. The training was available on the USB stick, allowing the participants to follow on their own time. A group of 89 participants from organizations such as our Bureau of Public Health, Medical Mission, the Psychiatric Center Suriname, and Dermatological Services have been completed successfully. The MOH, the Ministry of Health, constantly reminds the community about a healthy lifestyle to strengthen the general immune system. Also, several plans are being evaluated and new ones are being developed, such as the NCD plan, the mental health plan, the alcohol plan, and the salt reduction plan. Last but not least, I'd like to stress out the challenges Suriname is facing. As new elected government in July 2020, we were immediately confronted with the COVID-19 situation and a very deplorable economic situation. On top of that, we had a heavy rain season that affected the crops, what made basic foods such as fruit and vegetables very expensive for the general population. The lesson learned of this COVID-19 situation is that we as countries need a very responsive health disaster management. more investment in agriculture, and cooperation with other ministries to develop a more integrated and workable health in all policy. Thank you for your attention.
Thank you, Honorable Minister Ramdeen. Really much appreciated. Thanks for a very deep perspective on the situation reality in Suriname and for your leadership in trying to advance the whole issue of tackling non-communicable diseases and their risk factors. Now we're going to turn then to Mexico's experience with Dr. Luis Ridora, and he will share Mexico's progress in the implementation of front of package warning labels on ultra-processed food products in 2020. The use of taxes for sugar-sweetened beverages, and the effects on tobacco control currently taking place with the discussion of an amendment on the tobacco control law intended to make national legislation consistent with the Framework Convention on Tobacco Control. Dr. Lopez Vidora received a PhD from the School of Public Health from Harvard in nutritional epidemiology. He has a master's degree from the National Autonomous University of Mexico, UNAM, on health and from the Health and Dental Medical Sciences School with an emphasis in clinical epidemiology. He's a specialist in internal medicine through the National Institute of Medical Science and Nutrition of Salvador Subirán, and is a surgeon from UNAM in terms of his training specialization. He has vast experience in previous high-level leadership positions, working at the federal level of government and in academia. So I give you the word, Dr. Lopez Vidora. Thank you so much.
Thank you very much, Dr. Ansel Hemes, and many thanks to PAHO for the invitation and once again for the opportunity that you're giving Mexico to present to you part of the experience that we have had in Mexico since the start of the administration that started in December of 2018, and also about the plans for the prevention and control of NCDs has been strengthened by the urgency of the COVID-19 pandemic. So I am going to show you a few slides. I do believe you are seeing them now on screen in order to efficiently present my information. The important messages we would like to share with all of you and with the region, and I think in the region, it is very clear that the impact of the pandemic and the impact it continues to have among populations in which we had and continue to have a growing epidemic of chronic non-communicable diseases, particularly those related to obesity, but not only related to obesity, but poor nutrition, tobacco use, and the many other risk factors that both Dr. Barbosa and Dr. Hemes mentioned in their introductory remarks. So this came out in some of the editorial publications of the New England Journal of Medicine, focused on the important relationship with both obesity as a significant risk factor and for other chronic diseases that were the most important risk factors for complications and hospitalizations and mortality due to COVID-19 as diabetes, high blood pressure, cardiovascular disease, kidney disease, and chronic obstructive pulmonary disease. There are many social determinants as well that we have identified for decades. And a lot of this has to do with the environment in which the population moves around, both urban, but not only urban settings, also rural or semi-urban settings that are increasingly more reliant on unhealthy diets, as well as access to other risk factors that underlie the increase in these diseases. Once this was identified, and going on to the original ideas from before the pandemic, some of the transforming axes of this administration, such as when we took over and under the current administration, it was decided that particularly within the context of metabolic disease, and this constitutes almost 3/4 of mortality in Mexico in recent decades, we had identified two main axes of transformation. Was for the transformation of the food system, that is part of the primary prevention in order to reduce the impact of the growing obesity epidemic and the dual burden of disease. And another important need for transformation was in changing to a primary healthcare model, which has been promoted by PAHO as well. For both of these, I want to thank PAHO for its significant support on the local and regional level, because these two elements, both in terms of public policies that target changing in environments and food systems, these are some of the best buys that Dr. Hennis and Dr. Barbosa both referred to. These had been adopted as policies in Mexico as the engines to bring about this transformation on approach to health, but also the guidance of PAHO on the local level, particularly with the HEARTS strategy for the prevention and control of cardiovascular disease. And this also helped us make more dynamic the general transformation that we are bringing about within our health system under the framework of a primary health care approach to health. First, I'd like to very quickly go over what we have begun to do. And one of our lessons learned in this pandemic was how urgently we need to accelerate this transformation. We're starting with healthy eating habits. As I said, we had major success prior to the pandemic in both bringing about changes in the general health law and later in the corresponding regulations of it in order to make it mandatory to have front of package or have warning labels. And with this, we have the guidelines and the PAHO and local experts put together a profile of the critical elements and the critical levels that warrant these warning labels. But also, having put these warning labels into place prior to the pandemic, at a certain point, there was a lot of pressure. We were getting a lot of pushback from industry generally and on a global level, trying to postpone the imposition of these warning labels. But we said, no, in fact, we need to accelerate this, and not only accelerate it, but accompany this with a very sound policy to promote healthy eating and to be much more aggressive with our warning labels. This is what we are working on now. We are promoting a communications campaign with the warning labels and other actions as we seek to transform our food system, such as the regulations on advertising. We're working on this very actively, also to have much more control over access to advertising, particularly by children and adolescents. And an important part of regulating infant formulas and promoting breastfeeding as a healthier lifestyle. And we're putting this together with our actions in response to the pandemic. The schools have been closed down for more than a year. So we want people to come back to school and find vast transformation. And this is both for school settings and for work settings. We are trying to reinforce the regulation and control of these settings, which are determining factors of poor nutrition and other risk factors. So we are working on this. And what the pandemic also gave us was an opportunity with the general population to identify the need for these transformations and to accompany this with clear behavioral changes. And this is another thing which from the outset helped us This is a study that was conducted by the National Public Health Institute, in which they were able to identify and estimate that 70% of all deaths were attributable to consumption of sugary beverages. This was part of a discussion not only amongst the general population, but also with the food industry. So it was very helpful to point out the impact in recent decades of just one food, sugary drinks. And when this publication came out, and we also with the impact that COVID-19 was having, and this was one of the concepts that not only helped us hold back the attempts to postpone implementation of the warning labels, but to actually accelerate it and to act even more aggressively. The idea now is to expand. One of the things that we're very interested in, and this was another PAHO recommendation, and that was by 2023 to have a trans fat-free population. This had been achieved, a lot had been achieved throughout the world, and even in Mexico since 2005, we had reduced the intake of trans fats, but there had been legislative changes. Now, under the new regulations, we are doing everything possible to have much more aggressive regulations and thus eliminate trans fats from the Mexican diet. We also have the advantage, and this again, here we like to invite PAHO and the region, and also want to thank PAHO and other international organizations such as UNICEF and the FAO for accompanying us through the dialogues that we have been holding within our food system transformation group. We were selected to serve on the global summit on food system summit to be held in September. Within the context of that summit, we've included many sectors in these fora, in which we have also seen how to promote intersectoral actions and create synergies that can allow us to change the food system, and also invite the region to have specific regional partnerships, because the summit is a time of great relevance to have an impact not only on local food systems, but global ones. One of the programs that we are proposing that goes hand in hand with front of package labeling and other initiatives we're launching with the food system is to have clear communications about how to change behavior. UNICEF has been very important in its technical guidance, but we not only have a communications campaign targeting mass media, but we're also trying to bring it more and more down to the individual level. So within this behavior change strategy, we are bringing in all of the regulation components and put it together with a component to regulate local diet on that healthy diet that are culturally acceptable, that will allow us to change behavior. Another component that is mentioned is that of accelerating and having a more aggressive tobacco control policy, both in terms of advertising and through the media, and also to increase taxes not only on tobacco, but also on sugary drinks and high-calorie foods. And another element that was added more or less in May of 2020 is a new agreement on a health warning on tobacco products that also include messages related to COVID-19 and the impact of smoking on COVID. We've also been strengthening the regulation of other tobacco-related products, particularly vaping devices, e-cigarettes, and trying to find these legal loopholes. We are finding an increasing prevalence and use of vaping devices amongst children and adolescents. We are very concerned about this, so we are not only stepping up regulation of this, but also working in the field to try to reduce access to these kinds of products. Another component, and I'll conclude with this because this was part of our prior participation, but a lot of what has been done during the pandemic has helped us strengthen the national health system in two areas. First, the strengthening of primary health care within the primary health care strategy. Here, thanks to the urgent initiative to have community approach to primary health care for early detection and distance monitoring of suspected cases, in particular those with comorbidities. And together with the Senaprese Hearts PAHO program, this is the model that we have adapted to our own initiative in Mexico, and also the INSABI model, which is where we were beginning to transform our entire system through the Institute of Health for Well-Being. With these coordinated actions, we were able to have community health brigades who were doing case contact tracing, et cetera. And historically at the primary healthcare, at least in Mexico and many places within our region, has been far removed from community action. But now, given the need to care for people within the pandemic, we have used this strategy and adopted it as a permanent form of action. So we have community-based health brigades that reinforce the primary healthcare level. Another thing that was strengthened during the pandemic was intersectoral activity with the health sector. In Mexico, as is true in many of the countries of the region, we have our health system that is fragmented. There are people who have the right to the national health system, those who have right to the IMSS and the public health system, and others that do not pay into this. So there's a lot of differences in how people have access to the different federal systems. In our coordinated action for COVID, we saw the need and the virtue of, and now we have the obligation to have intersectoral activities. First, in order to share services, but not only to share services, also to have consolidated procurement, harmonized protocols for treatment. So at the end of the day, having these kinds of coordinated actions will greatly accelerate our ability for people to have access to physicians and medications free of charge for universal health care, regardless of one's employment situation. Another one has been the situation of heart attacks. We've been looking at the sector and the need to have action based in the community prior to hospital, the situation of thrombosis at the second level of care, and the need to have tertiary level of care with hemodynamics. But for these types of activities, we need to have the collaboration of the entire health sector for this to work. So we've been looking at intersectoral policies and been doing so more aggressively in order to change environments and clearly eliminating any conflicts of interest. Actions at the primary healthcare level, together with community action and intersectoral activity, lets the health sector all walk in the same direction. So this is part of the three main lessons that we have learned, and this is why we wanted to share this with you. And I am happy to hear of any questions or comments you may have that would help us continue to improve this type of activity in the region. Thank you very much.
Thank you so much, Dr. Rui. Really appreciate your help. And thanks for a very comprehensive look at the situation in Mexico. I'm now going to give the floor to Dr. Kelly Henning, lead of the Public Health Program of the Bloomberg Philanthropies. Projects under her direction include the Bloomberg Initiative to Reduce Tobacco Use, which is a 16-year project funded to the tune of almost $1 billion, which is a global program.
Much, Dr. Henningsen with PAHO, to participate in this effort to further address NCDs in the Americas. It's truly a challenging time to be discussing NCDs. COVID continues to ravage much of the region and has caused huge health and economic shocks. Health systems are overwhelmed with caring for COVID patients, and recovery will take time and resources. Many countries are experiencing a severe economic crisis at the same time. But the crisis also provides some opportunities to reform our systems, and in other words, to build back better. Even before COVID, we struggled to handle the demand for treatment from NCDs. As countries seek to rebuild their health systems after COVID, we must come together to focus on how to reduce key risk factors for NCDs, and by doing that, to reduce demand for services, and at the same time, to save lives. At Bloomberg Philanthropies, we focus on non-communicable diseases and injury prevention. This slide gives you a snapshot of some of our currently funded work. Collection, analysis, and use of health data is another major focus of all of our programs, so it's cross-cutting. Our biggest efforts focus on reducing tobacco use through prevention policies. And as was mentioned, we've committed 16 years of effort to this non-communicable disease work, and more than $1 billion for this effort specifically. Very shortly, WHO will release, with lots of input from PAHO and all the governments in the region, an update on the global report on the tobacco epidemic, which we are very proud to support, and we hope it will be very useful for your collective work. We focus on policies that result in prevention due to overwhelming evidence that by implementing strong prevention policies, we can reduce NCDs and save lives. And in doing so, reduce the burden NCDs place on health systems. We also support implementations of these strong prevention policies, because if policies are not implemented, we can't really move ahead. Our programs include food policy to promote healthy eating and prevent obesity and related diseases, tobacco control, which I'm going to mention in a moment, our Partnership for Healthy Cities work, which focuses on implementation of NCD policies at city level in 70 cities around the world, many of which are in Latin America. Over years of experience, we've learned that this has to be a multi-sectoral approach. And on this slide, you'll see just a small example of the many, many organizations that we collaborate with, and in some cases fund, in order to work on non-communicable diseases. The government obviously plays the key role in implementing prevention policies, but not just ministries of health, the whole of government. So health, finance, education, in some cases transportation, all of the ministries across government. And policymakers are so important to this effort as well, everything from presidents to parliamentarians and decision makers at all levels. In addition, we really need strong civil society pushing for policy change, with researchers providing evidence of the power of these changes, and of course, engaging the public in all of our efforts. Our partners also seek to engage legal experts, not only to assist in drafting effective policies, but also to defend such policies from interference from the industries involved in manufacturing and selling harmful products like tobacco. Our biggest opponent all along the way are various industries, with powerful companies often pushing back against our efforts to reduce the use of harmful goods. We're increasingly focused on how to direct, expose, and reveal the tactics of tobacco, food, and other industries to support governments to push back against these very powerful sources. For this, again, we need a strong multi-sectoral approach, and I'm delighted by the strong interest in this large and diverse group on today's webinar. I want to end by highlighting the massive change that has come through this approach. in our tobacco control program and congratulate this region for leading the way. Dr. Barboza, Dr. Hennis, and several others have highlighted that South America is the first continent in the world to go 100% smoke-free. In the first days of our initiative on tobacco, we supported Mexico City to become a smoke-free city. And now in 2021, the progress is absolutely remarkable. And even though we've all mentioned it and it may feel redundant, I really think we should celebrate this amazing accomplishment across South America, because it is such an amazing story that we can all feel really confident is being shared across the world with other regions.
All right, I'm going to get back to work on
And you've made great strides in large pictorial warning labels on tobacco packages. You can see the global progress here and the exciting progress across the Americas. One policy that I would like to highlight, and others have done as well, is that collectively we've made quite a bit less progress on taxation. I'm thinking particularly of tobacco tax. It's the most effective policy, and it really drives our prevention efforts, but it lags behind other prevention policies, in part because it's a whole of government approach that's essential to make this work. So we really have to double down and think further about how to engage other sectors in tobacco taxation and other excise taxes that are relevant to NCDs. In particular, we need the expertise and the commitment of ministries of finance to use their fiscal powers to improve the health of all of our populations. Tobacco taxes not only save lives, but they also bring in revenue. WHO estimates that a $1 increase in tobacco tax can not only save lives, but if allocated to health, it boosts health revenues by 4%. Given the current health and fiscal crises we are experiencing with COVID, raising tobacco tax is a clear win-win for all of us. The Americas are leaders in prevention, and now is the moment, with the pandemic top of mind, to use this expertise and experience to push forward with NCD policies that will save lives. I am truly honored to be here with you today and with all of the esteemed colleagues at PAHO. We hope the Americas will continue their leadership in NCD prevention, and I look forward to working together with all of you to save lives. Thank you very much.
The severe crisis, thank you very much. I would just like to underscore something you said about the severe crisis that the region is going through, and this is an opportunity for us to accelerate and scale up the changes. Now, you reminded us in the work done, the focus that is placed by the Bloomberg Initiative that includes a number of actors. And within that framework, I would like to now open up this venue for two panelists who will be showing us the wealth of joining efforts, what can be done by joining efforts. We've heard from the Minister of Health of Suriname, the Director of the Ministry of Health of Mexico, and now we are going to have two representatives of the region of the Americas who will address us, who are behind many of the success stories that Dr. Ginning referred to. So first, Oscar Cabrera, and then Dr. Beatriz Champan. Oscar is the Program Director of the Healthy Families Initiative of the O'Neill Institute for National Global Health Law, Georgetown University. Dr. Beatriz is the Regional Coordinator of the Healthy Latin American Coalition, CLAS as it's known. So, Oscar and Beatriz, they deserve a full introduction, but they don't need it. They're known. Oscar is well known from the Healthy Families Initiative, also visiting a professor at the Global Health Law School at Georgetown University. Now, a question for Oscar. For starters, Oscar, you have broad experience in Latin America, and you have seen and you have advised many countries who have tried to implement policies such as we heard mentioned by the Minister of Suriname, as well as the Director of Mexico, front labeling on products, tobacco controls. Over all these years that we've been working on this subject matter, and we know we have because we've collaborated, we have seen how industry that's at the base of production distribution of these products are opposed to public policy that is backed by World Health Organization policies and others. However, despite that pushback, we have been successful. We've seen an example of that in Latin America. There was an attempt to backslide in Peru, and there was a constitutional ruling that upheld the restrictions that had been placed. So we know what the arguments are. We would like, and we certainly can shoot those arguments by the industry down, but I would like to know how law can enable us to be more effective. Thank you, Rosa. I was going to speak in English, but since you asked me the question so clearly in Spanish, I'll try to answer in Spanish. I think that the main issue here, I'd like to start these debates with a focus first on why. Because the legal debate, when we push forward with public policy to regulate risk factors, the debate always revolves around, can the government do this? Can the government produce or create a smoke-free environment in the workplace? Can the government impose the use of front labels on products? And we never ask, or at least we do it much less, what about the lack of action on the part of a government, which also has a legal aspect to it, can make it liable, because the government has a constitutional obligation and international law to protect public health. That falls to the government. And in this context, when there is total lack of action by a government, when we have clear evidence of the impact of these diseases on society, we have clear evidence of what the risk factors are in enhancing the prevalence of certain diseases. So that's how I like to broach these matters and the questions posed by industry about, can the government do this or that? I would say rather, why don't we create an incentive for governments, give the tools governments to act, and not just let the industry hold the narrative. So there need to be normative legal frameworks that go beyond the health sector. A colleague wrote an article talking about states' obligations to regulate business, to keep businesses from having a negative impact. That within context of human rights. So there's an obligation to regulate. There is an obligation to regulate the private sector. That's clear. Something else that's also very important, I'll just take a couple of minutes to try to respond to your question, has to do with how businesses or tobacco and food producing companies use legal arguments that aren't really, they're specious, though very powerful. They're not really rooted in law, but they're still very powerful. And so they erect a smoke screen. For example, bringing these measures into line with the World Trade Organization or CARICOM or Mercosur or others. Yes, it is a very powerful narrative and seemingly powerful argument, but usually they aren't rooted in law. There's not a sound footing in law. And we also use the example of Philip Morris's request for arbitration vis-a-vis Uruguay that was posed as a threat. When Uruguay does this or that, it violates bilateral norms to protect private investment. So what happened? That's like the common expression we say in English when the dog that chases the car finally catches the car. And so they just back down because, yes, the state does have police powers to regulate these factors, and that does not affect the framework for investment. And the fact that this happens within the bilateral investment treaty context calls our attention to this. We're talking about a court whose mandate is to protect and to implement these investment protection agreements. And it said that when products have a negative health product, companies have to expect there to be a more restrictive regulatory environment and understand that the states do have the obligation to protect public health and therefore are going to regulate your products. That happened in the case of tobacco, but the fact that that carve-out was written, that does have bearing on other risk factors, not just tobacco. Food, the same thing happened in Chile as far as labeling and all the threats that front labels, that they were on the cutting edge on that. And that now has set the stage for the whole region to use front labeling. Also, the World Trade Organization's standards, and the same argument can apply. Now, within that context, connecting this to the first idea, yes, we do have to answer industry's arguments, and that's really quite easily done. We heard just about the Colombian Constitutional Court ruling. I love to see these legal arguments in debates here at the Pan American Health Organization. Yes, the state can discourage the consumption of given products that have a negative effect on health. That they're not prohibiting these products. These aren't arbitrary measures. They're just trying to discourage consumption of harmful products. And that was held up in the court. And that freedom of expression and advertising doesn't have the same degree of protection that other forms of expression have. And so you see that there's a success in a court in one country, it's exported to others. That's one approach, but we have our legal narrative that we need to move forward with and not only react to industry. There are constitutional obligations that states are bound by to adopt such health protecting measures. Within this context, I would like to conclude with two brief remarks. First, the more we can use public policy to rein in risk factors, rooting that to a constitutional law strengthens this because that protects those measures from the ups and downs, ins and outs of the political process as administrations come and go. That can be viewed as a regressive, but it needs to be tied to these overarching constitutional legal obligations to protect public health. Now, one other issue. In international law, progress has been made regarding the interest, corporate interest, vis-a-vis government interest, and that corporate culture sometimes can be a form of corruption because it undermines the state's regulatory capacity, given how much control corporations may have. Now, a recent statement about frontal labeling as being viewed as an effective tool to protect health, and that the best evidence needs to be used for that purpose, and to solidify this policy as one that is in keeping with fundamental rights of people, and to try to limit the meddling or influence of private actors in this. Now, COVID, as you said, has created a worldwide health crisis, without a doubt, which spills over into the economy. But going back to talking about the post-COVID context, there's an emphasis in investing in disease prevention, public health, regulatory measures to prevent the increase of disease. Our health systems have collapsed, and we need to. We know that the health systems are going to continue to have a hard time if there is an increase in non-communicable diseases, NCDs. Now, this legal strategy from the standpoint of public health, that is to promote public health and to do so by addressing risk factors for NCDs, this should not be a reactive process alone. A lack of action also brings with it legal responsibility. I like that approach. This is something we always hear, that inaction brings with it costs. We hear about that in economics. It applies to health as well. So now I would invite Beatriz. Beatriz has a doctor's degree from University of Luther, Rutgers University, and a BS, Bachelor's in Science from the University of Illinois. Has focused much of her career on the healthy and alcohol control. Now, in your experience, Beatriz, in the region and the challenges faced over the years and the success that we've seen in the region that you have had a hand in, from your standpoint, how do you see going forward how we should tackle, promote policies that would rein in industry? First, I would just like to thank you, Rosa and Pajo, for this opportunity.
When one thinks about this current moment we are in with the pandemic, I think it's helpful to do a brief overview of where we were before and where we are now. This allows us to see the tremendous growth and change civil society has gone through during this period. This is one of the advantages of having reached a certain age. I remember what was going on 20 years ago. 20 years ago, we had pioneers in the region, and we must acknowledge that they were a bit isolated. People thought they were crazy, but these are the people who opened a lot of doors to the changes that needed to be made in tobacco control. I'm talking about Dr. Castro of Uruguay, Adrianza in Venezuela, Rosenberg in Brazil, Vinicius in Peru, Lopez Antuñano in Mexico, Verazo and Shadrowski in Argentina. These were like prophets screaming in the desert, but they did their work almost like a hobby. It was something that they did after their daily job as physicians. Most of them were physicians, and that changed everything, and dramatically and quite quickly. There were two things that they did to bring about this change. First of all, the Framework Convention on Tobacco Control. And secondly, the influx of resources for the Bloomberg Initiative. We must be very grateful for them here. So we went from a situation in which this was civil society's hobby to really professionalizing all of the civil society groups. And this has helped us out tremendously in moving forward with these effective strategies and policies. We also need to express a lot of thanks or point out and acknowledge the work of Pajo. I think that you had made a brilliant decision when you decided to work on your tobacco strategies around smoke-free environments. And I have to say this because we needed to get the population itself and public opinion to change. Public opinion was not going to change with some of the other strategies. Smoke-free environments changed public opinion about tobacco control and about the tobacco companies. That is happening a bit now in terms of nutrition. Civil society, well, in civil society, we've reached an agreement, and also with Pajo and other entities, that front of package food labeling also opens doors for us because it changes the perception of the public. Sometimes the general public often doesn't know very much about why you need to have this labeling. Why is a certain kind of unhealthy food not good for me? And this allows us to change public opinion up to the point that makes all of the other strategies we mobilize more effective. I would like to briefly mention that civil society networks have changed. Now we have attorneys such as Oscar Cabrera. We have economists such as Guillermo Barra in Chile, Belén in Mexico. So we have really increased the number of professionals in various sectors, communications experts that help us explain and teach us how to communicate. And this has had a big impact. There's many examples that have already been mentioned here, but for example, recently, Oscar just mentioned the issue of Mercosur. We had to clarify and send legally clear messages to them that Mercosur needed to bring the Ministry of Health on board. Often the people who attended these meetings were just from industry, like the other ministries, and civil society was not participating. So these kinds of tasks were carried out by civil society after developing a strategy. And similarly, we have done similar things in many other areas in which we needed to have a rapid response. We could reach 50 senators in Colombia in 48 hours with a message that might change, like to postpone consideration of a bill or to defend legislation that was under attack. And the main challenge, there is no doubt that the main challenge is the unhealthy products industry. There's a lot of documentation of this. And now with the STOP project and these centers of excellence, such as the one in Thailand, there is a lot, and it's the interference of industry has gotten even worse during the pandemic. They have a lot of advertisements that are hard to respond to, but there is also a lot of disinformation out there, and civil society is consistently monitoring the bad information that so easily reaches so many people. When civil society is well organized, there is response capacity, but that is not true in many situations. There are many countries in our region in which when the industry says something, it's just out there, nobody responds to it. I think we cannot allow this to happen. Central America, we're working on front of package labeling right now. And we've spoken with the groups in Central America, and they tell us, well, people are not aware of this. They don't even understand our language. So that is the first action we need to take before we get to front of package labeling. And briefly, I'd like to mention the issue of alcohol. We are also lagging far behind in terms of alcohol prevention in our region, but there is a lot of evidence that shows that there is no level of alcohol consumption that is appropriate or safe. One of the things that our organization has done is put together an alcohol strategy working group. And we are trying to focus on the damages caused by alcohol to children and young people as a gateway to reaching other people. And we also talk about inequities and social injustice. We know that it affects the most vulnerable people, particularly the poorest people. So just by way of summary, this is a major struggle on a day-to-day basis in civil society. It requires a lot of perseverance, stamina, and physical and mental fortitude. We have several WhatsApp groups to allow us to have continuous interaction with civil society. That gives us greater strength. When there is a country that has a problem, then we can be there. The region needs to have a certain brotherhood that allows us to move forward with these efforts. I am optimistic that this will continue to improve, and I am fully in agreement with Oscar that we must anticipate. we often are left just to react. We can't let it be that way. We have to move forward and do so by anticipating what industry and other sectors will do. Thank you. Thank you very much, Beatriz. And I'd also like to take this opportunity to indicate that we have several questions in the Q&A section. I think you've brought up some of the points that the participants are also raising. First of all, you spoke to us about the importance of professionalizing civil society, also in terms of resources that allow us to have a professional approach, the strategic view, the need to find an entry point. That is very clear. You told us about that with tobacco, front of package labeling, on foods. I think Arturo is asking about the safer and alcohol. If perhaps you could respond in writing, but I think that we are working together to identify these gaps, and we need to strengthen the agenda on alcohol. Another gap that was referred to is that of taxation. So these are some of the gaps that have to do with the whole holistic approach of interventions. There need to be interventions that look at different sets of products in terms of taxes. And also we need to have a geographical approach such as Central America. You said there is not enough civil society responding there. And as you said, we need to anticipate and not just react. So I now invite the panelists to respond. First, the question about taxation specifically. And of course, we do see this as something that is pending in the region. And perhaps it's one of the things that we could say in response to Maria Rios. What do you do to raise awareness of this? You need to anticipate and learn how to communicate with the population so that the population will begin to demand these things. They need to understand that they are disinformed about tobacco and about unhealthy food and etc. And also, I also would like to ask Oscar and Beatriz to add something in terms of their recommendations for the future and how we can make the best out of the opportunity afforded to us by the COVID-19 pandemic. Beatriz, if I may briefly say something, I think that the pandemic does give us opportunities. What is happening is, of course, horrible, but there are opportunities therein. There are several countries in the region who are going through tax reform processes. And taxes are something that are crucial right now. Maybe 2 or 3 years down the road, it won't be as important, and it wasn't previously. But right now, this is the policy that we can move forward with. And there are some new things. There are new virtual modalities. And there is an opportunity to include people who are maybe on the edges, but now we can meet with them. We hold online meetings with young people, and 1,000 young people showed up. Also, people who are affected by these diseases, and 100 people attend. So this moment in time has some characteristics that pose a very significant opportunity for us. Thank you very much, Beatriz. Oscar, would you like to add something? Yes, I'll just react very briefly, Rosa. When we talk about taxation and fiscal measures, it would seem that that is the exclusive domain of economists. However, we've discussed this extensively. We have evidence of the effectiveness of fiscal measures to reduce the consumption of harmful products. And this helps us comply with our human rights obligations. So if we want to move forward in respecting fundamental rights, we have to use the evidence. And the evidence says that taxes, but also extra non-tax things, trying to how we present the products and everything. So we have to break through the private market's control of this. So we have to look at this we have to look at there is an obligation to respect these rights. We look at the measures that have a positive impact on public health when they're done appropriately. So we should also talk about taxation as another way of protecting fundamental and constitutional rights. Yes, saying, continuing with my motto for today, let's not react, let's anticipate. In this case, we can apply that narrative to taxation as well. This is one of the spaces in which we have a lot pending in terms of progress to be made. So without further ado, we have the other panelists with us. If you would like to react to any of the questions from our audience or make a comment, and if not, I'll give the floor to Dr. Hennis again to close the session since our time is up.
Thank you so much for that very stimulating presentation. I think we had a lot of very rich contributions. I think it's a bit of a pity that our time came to the very last minute, and I'm still trying to start to respond to some of the queries in the chat, and perhaps people can communicate with us afterwards through PAHO. But really, the perspectives on tobacco, on alcohol, on civil society's rules, on tax laws, on the rights of people first and foremost. All these issues are critical issues which are really integral in terms of the discussion on tackling risk factors for NCDs. So we really had tremendous contributions from our panel, as well as from our representatives from the ministries, the Minister of Health of Suriname, the Dr. Rui. Really appreciate him coming to help us again this morning in the absence of the minister, and of course, Dr. Kelly Henning. So we really had a wonderful time, and really very grateful for all the contributions. What we will do, we will actually produce a summary of this session, which we will share and share on our website at PAHO, as well as we will share a recording of the session so people can again see it again and have more questions answered in the future. But I think this has been an amazing time, and I think there are lessons learned that we really have to take on board as we go forward. So thank you very much for all your contributions. Thank you for all the participants. And for those who are able to answer us yet, please write to us at PAHO. We try to answer your questions so we don't leave anybody unsatisfied. Thanks to all, and again, it was a wonderful time to discuss and share ideas on tackling non-communicable diseases. Thanks for your participation. Really very much appreciated. Thank you. Thank you.
Thank you, everyone, and enjoy your afternoon.
Thank you. Creo que respondí a todo. Ok, bien, no problema. Una tarea muy factible.